Thank you, Peter. Well, good afternoon, ladies and gentlemen. It's really great to be back in academia after several years. I'd like to start by thanking Becky and Mark for inviting me to this excellent symposium to learn and also share some of my experiences. And I also would like to thank International Labour Organization, particularly Barbara Murray, for supporting my visit to come and attend. Okay, so I work for the organization called Social Services Initiative. It is a local non-profit organization based in Baku in Azerbaijan. We are governed by our board of directors. We have about 60 professional staff across the country. We have head offices and also 9 different project offices. We're trying to establish or support establishing an inclusive society where social justice and equal opportunity ensured and human rights are protected and valued, including rights of people with disabilities. I'm sure some of you have never heard the country named Azerbaijan, so that's why I put a small map here. It is a very small country. It's about the size of the U.S. state of Maine. We're about 9 million people. It was part of the former Soviet Union. We are squeezed between Iran and Russia, as you see, in the region called South Caucasus. Politically, it is part of Europe, but more of culturally, it's more of a Middle Eastern country. We have a population of 9.2 million, area of about 86,000 square kilometers. For more information, you can go to Azerbaijan.org, and also lots of ads on CNN these days. By the way, Azerbaijan is an oil country, so we produce oil, that's why there is money. In fact, recently it was upgraded to an upper middle income country. So about people with disabilities in the countries, there are about 500,000 people with disabilities. It's about less than 5% of the population. Some people believe that basically number of people with disabilities are underestimated or underreported because WHO figures are 15% of population, so this is really not realistic. Some of the services, government services that people with disabilities get in Azerbaijan, basically everyone who has a disability certificate has the allowance of $44 to $82. There are 3 degrees of disability, and depending on which degree you get a cash allowance. They're entitled for free rehabilitation, free education and health services, and in some cases, particularly war veterans are entitled to receive free government housing and free cars. Azerbaijan is one of the first countries in the region to ratify the UNCRPD in 2008. About the rehabilitation system, briefly, there are about 14 government-run rehabilitation centers across the country, mostly centralized in major cities. Government rehabilitation services does not provide services for the families, and there is no social support component either. So that's why the model is strictly medically oriented. Among those 14, 2 centers are for children, the rest are for adults. And also in recent years, some NGOs also started to run centers for rehabilitation and rehabilitation centers for particularly children. And SSI is one of those. Actually, we don't run a center, but we run a program of community-based rehabilitation in 10 districts of the country. Okay, so what I'm going to talk today, I'm going to talk about a situation analysis, a study which was commissioned by the Minister of Labor and Social Protection, a government agency which is leading the disability affairs in the country. It was supported by the International Labour Organization and by SSI, and conducted in 2012 by the SSI of organization and the European Platform for Rehabilitation, EPR. The study basically was requested by the government because they want to change the current system, which is based on the Soviet model of services, to make it the one that which will meet the requirements of the UNCRPD and also meet some of the directives of the EU. Because as I said, we aspire to become part of the European political system and social system by large. That's why with this study was taken, and then the study covered 2 districts among these 14, sorry, 2 centers. So the 2 centers are, one of them is Prosthetics and Orthopedics Center, which is located in the capital city. Another one is Rehabilitation Center for People with Disabilities, which is located just outside of the city, Baku City. So in Prosthetic Orthopedic Center had served 6,300 patients. This is 2011 figures. They have total staff of 200. They have 2 units, 1 hospital, 1 production unit, and they mostly serve landmine victims, road traffic accident victims, etc. And the Sumgayit Center is much smaller. They have served 376 people only in 2011. They have 42 total staff, and they basically serve people referred by the MSCs, Medical Social Expertise Commission. Basically, they decide on disability certification. They also decide on services. Most of the staff in both centers are either medical nurses or the doctors. Some orthopedic and prosthetic specialists also work, but not much. So what we did, we interviewed government officials. We've met the management of both centers. We've organized focus group discussions with staff separately in each center. Also, we had user interviews, focus group discussions with users, meaning service users, and also we've listened to DPOs, parents, and family organizations. And also we visited centers, looked at the conditions there. So what are the key findings? On the good side, both centers have a very motivated staff members. They're committed. They love their job. They want to do their job. One of the interesting things that we didn't expect to come up was that the users value these centers more of a respite care facility rather than rehabilitation center. Meaning, if anyone wants to get services of these centers, they have to spend 3 weeks there, so 21 days. It is a requirement, so it is a residential service in a way, because it's built on a hospital model, on the Soviet defectology model, meaning that you come in, you get cured, and then you get fully treated and then go back. So that's why since people come and stay there, they get they get that respite care. They can get free of their daily problems for 3 weeks, and also their families can get free from their pains and problems. So most users value these centers as a respite care center rather than a rehabilitation center. Some of the centers provide health maintenance services more rather than rehabilitation services, meaning if you have a health condition, these centers will help you to maintain that health condition. It will not deteriorate. There is a substantial demand for services. You look at the figures I gave, about 500,000 people with disabilities, but total 14 centers serve only 8,000 people a year. And also centers have some equipment that they use. On the not very good side of things, we realize that the staff has very, very narrow competence base. For instance, someone will be doing only wax. That's it. What you'll do, I do wax. Nothing beyond that. And there are different equipments. One person is assigned to that equipment only, and that stuff does that only. Nothing beyond that. There was no rationale. We couldn't find out why a person should stay for 21 days if the person wants to get a service. There was no real link between the patient's need and the services or program offered by the centers. And also there was no link between the long-term goals of the centers and the program, so forth. If you look at the mission of the centers, it says For instance, a better inclusion of people with disability into society, but what they do in the program, we couldn't find a link why they do program. Again, very strictly medical approach, and some of the equipment are very old and outdated, and even we questioned the logic behind using those equipment. Sorry. On the policy, legacy, and system level problems, we realize that funding mechanism is the problem. Thank you. The requirement for residency actually is because the funding is tied to bed occupancy. If you have more people in a higher percentage of bed occupancy, it means you get more funding. If you don't have bed occupancy, you don't get funding. That was the problem. There was no standards or quality assurance system in place. Methodologies are used by the centers are outdated, mostly from old Soviet time, guidelines which have not been, reviewed or cross-checked with international literature. The evidence base for most of the treatments at the centers, we couldn't find any evidence base. Basically, people don't. The centers do not assess whether they have made any impact on the lives of their clients. And also, there was no post-acute medical rehabilitation center in the country. Most of these centers just provide routine medical services. Continuum of service is a big problem. Once you're there, you get 2 weeks of services, and then you get out. If you're lucky, you will come back after 1 year. But the center does not care what happens to the person when the client leaves the center. The life in the community is very difficult. The center's functions does not meet the requirement. None of the centers actually functions meet the requirements of the UNCRPD. There's been very little investment in staff training. In fact, there was no staff training in the last 5 years for none of these centers. Strikingly, centers do not provide any assistive technology. The 3 things that they provide, this is wheelchairs, and this is some orthopedic products, and hearing aids. But these are centralized only to one district, which is one center, which is in the capital city. So from one side of the country to another 500 kilometers, if anyone wants to get a wheelchair provided by government, they have to travel all the way to capital. And then getting is not always ensured because you may have to stay in line and queue and get maybe in 3-4 months. Again, one of the interesting features or striking features, as the report put, the centers can be regarded as no tech rather than low tech. There was no technology whatsoever. They use very old methods of measuring, for instance. And centers do not use any IT equipment. For instance, the information sharing is done manually and on hard copies and everything. But basically, government wanted us to give them recommendations what they need to do to reform these 14 centers. So first of all, we said that they should promote the research and development to find out what are the available technologies in the world and what are those technologies that can be easily imported in the country and applied. The second, we said that the persons with disabilities should have access to information. They should know. Most of the cases, people don't know that there are such centers exist that they can use the services from. Professional training of the staff is important. We've highlighted. We also said that there should be a comprehensive staff development plan spanning maybe 5 years, because there aren't many specialists. Most of these people are medical doctors. They don't have OTs or speech therapists, etc. So they need to come up with a plan to design that. To redesign the residential plan so that there is no requirement for residing 3 weeks. We said that the government should introduce national standards of quality and also revise the theoretical base for some of the programs that they offer or services. We said that government should establish a state-of-the-art post-acute medical rehabilitation services at least one for the country, because there is more and more road accidents. And also there should be continuum of services for the beneficiaries. And also there should be a national system to ensure access to assistive technologies which are very cheaply available, particularly for the country which has, oil petrodollars coming in. Overall we've put together a three-phase reform program. We said in the three phases, the first phase we said there should be initial capacity building within the ministry government itself to set the stage to prepare a reform program. In the phase 2, actually to design that reform program and then approve it, and also allocate budget, and in the phase 3 to implement that reform program, which will take about 5 years, I believe, so that the centers can meet up the requirements of the UNCRPD. Basically, that's it. I tried to be quick. If any questions, or you can contact our organization, or you can ask them. Thank you.